And at the end of the presentation, if any of you are doing shockwave therapy in your offices and you're interested in becoming part of the SWEET study, the Shockwave Erectile Enhancement Trial, we're just 2 weeks into patient recruitment. Already after 2 weeks, since we have 45 offices contributing patients, we're already up to 50 patients within 2 weeks. And I want to acknowledge Dr. Shaskas, who 27 years ago took a chance on me and helped me get into UCLA as a residency. It's an honor to be able to talk at the same meeting that he is. So we all know that shockwave therapy has tremendous promise in terms of curing erectile dysfunction, or at least growing new blood vessels. So as opposed to something like a PDE5 inhibitor where you would just take it, get better temporarily, shockwave therapy has the potential to create angiogenesis. And we've all seen Dr. Liu's research where he shows upregulation of stem cells, upregulation of blood vessels, upregulation of eNOS, upregulation of VEGF. And so we all kind of are basically familiar with the science behind this. But every meeting that I go to, or every paper that I read, says we need more data, we need more large-scale studies. So as a private practice urologist, I'm not in a position to do double-blind, placebo-controlled studies. My patients aren't going to sign up for a sham-controlled study, but I'm really very interested in the results of shockwave therapy and to really prove once and for all that this actually either works or doesn't work. And to me, the best way to do that is to get a tremendous number of patients to participate in a study and use a variety of protocols, and maybe we can begin to assess whether there's one protocol that works better than another protocol, or one machine that works better than another machine, or one frequency or shock rate, or radial versus focused. And so I called up 45 of my best friends and said, Boris, can you contribute data for me? And I went through the trouble of an IRB, and I tried to raise money from the machine manufacturers, but unfortunately, none of the machine manufacturers were really interested in anteing up some money. And so basically, I'm self-funding a study through a small supplement company that I started with my wife, and we're self-funding this study to try to see if we can figure out something about shockwave therapy. One, to find whether it works definitively. Two, to try to figure out what treatment protocols work better than other treatment protocols. Three, collect some information on some of the ancillary things that we're doing around shockwave therapy. Do vacuum erection devices help? Do nitric oxide boosters help? Are some of the regenerative therapies contributing to the outcome? And so we're using SurveyMonkey because I don't have the money for some fancy research software. And Scott and I created a device to basically collect information from patients, basically demographics and medical history that's really significant for erectile dysfunction. So if they're on beta blockers, if they're on SSRIs, do they smoke, do they drink heavily, do they have coronary disease, do they have diabetes? And then we took some basic information from the physicians. So what machines do you use, what's your protocol? And then we de-identified patients, so it's totally anonymous, and we're basically getting the information directly from patients. So it's not coming directly through us, it's coming directly to the database, so there's no skew in the data. It's not like the physicians treating the patients are saying, rate me really good. It's all coming in de-identified, and so what we really want to do at the end of the day is to take a tremendous number of patients and get their data and see what we can learn from that. And so initially what we learned is that there's a tremendous amount of variability in terms of, one, what machine people are using. So about a third of folks in the study, these are 45 doctors, 22 of them are urologists and 22 of them are non-urologists. A third of them are using the Zimmer machine, a third of them are using the eVive machine, and a third of them are using the Storz machine. And then I think we have one or two using the BTL Cellutone machine. And then in terms of what the actual treatment protocols are, you can see it's all over the map. So anywhere from a total number of shots at 18 think the lowest number was 18,000 total shots, all the way up to over 150,000 total shocks. So 150,000 would be 10,000 shocks times 15 treatments. I think the highest was 18,000 or 400,000. So, I mean, someone's really giving a lot of shots. So, basically, what this shows is that there's a huge amount of variability in terms of how we're providing shockwave therapy. And I really would appreciate, one, anyone's input in terms of how to best run this study to get the most amount of data. Two, anyone that wants to sign up and contribute their data to the study will be allowed to mine the data and write papers using this data. And if we have 3,000 or 4,000 patients, there are going to be a lot of papers that come out of this. You can compare diabetics versus non-diabetics, or smokers versus non-smokers, or 5,000 shocks versus 10,000 shocks, or the Zimmer machine versus the EVOD machine, or, I mean, the sky's the limit in terms of doing that. And what I'd really ultimately like to be able to do is to create some sort of treatment algorithm, almost like the prostate calculator. You know, go to prostatecalculator.net, you put the PSA and you put the Gleason score in, and it gives you data, information on how to best treat the patient. What I would really like to do at the end of the day, if we have a huge number of patients, is to be able to have the patient fill out a SHIM score, have the patient put in their age, have the patient put in some basic information, you know, do you smoke, are you diabetic, and to be able to kick out a treatment protocol that best serves the individual patient, because clearly you're not going to treat a 55-year-old with mild ED the same way that you're going to treat a 75-year-old with diabetes.
So, $1 million question, is there any early